I've spent over 3 decades working in emergency rooms, and I need you to hear this clearly. Most people over the age of 60 will not survive their first heart attack if they're alone. That's not meant to scare you, it's the truth. Nearly half of all heart attack deaths happen before the patient ever makes it to the hospital. Why does this happen? Because valuable time is lost. People hesitate, panic, or simply don't know what to do. They miss the simple, life-saving actions that can keep blood flowing until help arrives. The harsh reality is that without this knowledge, a person can be gone within minutes. I've seen countless patients brought into the ER who could have survived if they had acted differently in those first critical moments. Crushing chest pain, sudden breathlessness, dizziness, cold sweats, and by the time they arrive, it's too late. The golden window to save the heart has already closed. But here's the good news. There are science-backed, proven techniques you can perform even if you're completely alone. These aren't gimmicks or myths. They're real strategies that cardiologists teach their patients to help them survive. In this video, I'll walk you through 7 life-saving tips every senior must know to survive a heart attack when nobody else is around. These are the same steps I wish every patient in my ER had known before their attack. And wait until you hear number 3. Research shows it can mean the difference between permanent damage and walking out of the hospital alive. Most people have no idea these techniques exist, but after today, you will. All the medical references and scientific studies I mention are listed in the description below. Before we begin, I'd like to ask, how old are you? Tell me in the comments. I personally read and respond to every single one like it's a conversation in my clinic. Now, let's begin with number 7, the very first step that could determine whether you make it out alive. Number 7, call emergency services immediately. The first and most critical step when you feel heart attack symptoms is simple: call emergency services right away. Don't wait or second-guess yourself. Don't think, it's just indigestion, or I'll see if it passes. Every minute you delay, more heart muscle dies. Cardiologists say it best: time is muscle. The longer blood flow is blocked, the lower your chance of survival. According to the American Heart Association, calling for help within the first 5 to 10 minutes can raise survival odds by up to 50%. Sadly, many seniors hesitate. Nearly 1/3 wait over 2 hours before seeking help, often thinking they don't want to bother anyone. That hesitation can be fatal. Take the example of a 68-year-old man who ignored chest pressure for hours, thinking it was gas. By the time help arrived, the damage was irreversible. Doctors said a simple phone call could have saved his life. So if you ever feel crushing chest pressure, sudden shortness of breath, nausea, or cold sweats, act immediately. Even if it turns out to be nothing, you've lost nothing, but if it is a heart attack, you've just made the most important move to save your life. While waiting for help, what you do next can keep your blood flowing, and that brings us to tip number 6. Number 6. Chew an aspirin if available and you're not allergic. After calling emergency services, the next action could mean the difference between life and death. Chew an aspirin, don't swallow it. Aspirin isn't just for pain. It's one of the most powerful over-the-counter drugs that help stop blood clots. Since heart attacks happen when a clot blocks blood flow to the heart, aspirin works by thinning the blood and preventing the clot from growing, keeping some circulation going until help arrives. Research published in The Lancet found that taking aspirin during a heart attack can reduce the risk of death by 23%. But timing is critical. Swallowing a whole pill can take 10 to 12 minutes to digest, while chewing it allows the medicine to enter your bloodstream within minutes. Those few minutes can save your heart muscle and your life. One 70-year-old man survived his heart attack because he remembered to chew an aspirin while calling 911. Paramedics later said that quick action prevented major damage. If you're not allergic and your doctor hasn't warned you against aspirin, keep a bottle of plain, not coated, aspirin within easy reach. Doctors recommend chewing one full 325 milligrams tablet at the first sign of a heart attack. Think of it as sending in an emergency rescue team to slow the damage until professionals arrive. It won't stop the heart attack completely, but it can prevent it from getting worse, buying you precious time. Now, surviving alone isn't just about what you take. It's also about how you move your body in those critical moments. That's where tip number 5 becomes vital. Number 5. Loosen tight clothing and sit upright. When a heart attack strikes, even small movements can affect how hard your heart has to work. One of the simplest yet most overlooked actions is to loosen any tight clothing and sit upright. Tight belts, collars, or waistbands can restrict circulation just when your body needs oxygen the most. Sitting upright relieves pressure on your lungs and diaphragm, making it easier to breathe and reducing strain on your heart. Lying flat forces your heart to work harder, especially if you have weak lungs or conditions like COPD. Sitting at a slight angle with your back supported helps air flow more freely and improves blood movement through the body. A clinical review in the European Heart Journal found that keeping patients upright during cardiac distress reduces fluid buildup in the lungs, the suffocating pressure that often makes breathing difficult during an attack. One 74-year-old woman in Florida felt chest pain while gardening. Instead of lying down, she loosened her apron, sat upright, and waited for help. Doctors later said that small choice likely prevented her from collapsing before paramedics arrived. So, if you ever feel chest pressure, shortness of breath, or a cold sweat, sit up straight, relax your shoulders, and loosen anything tight. It gives your heart and lungs room to breathe and helps you stay stable until help arrives. But to keep blood flowing to your brain and heart when circulation is under attack, you'll need the next step. Tip number 4, a powerful physical action anyone can do while waiting for help. Number 4, cough strongly if you feel faint. It might sound strange, but during a heart attack, coughing deeply and forcefully can sometimes keep you alive long enough for help to arrive. This is known as cough CPR. Here's how it works. When you cough hard, your chest muscles tighten and pressure builds inside your chest. That pressure pushes blood out of the heart and toward the brain, keeping you conscious for a short time when circulation is failing. Now, cough CPR isn't a cure or a replacement for medical help, but it can buy you precious seconds if you start feeling dizzy or about to faint before paramedics arrive. Research in the Journal of the American College of Cardiology found that strong, repeated coughing helped patients stay conscious and maintain blood pressure until treatment began. A 69-year-old man in Texas once survived this way. Alone in his workshop, he began coughing hard every few seconds as he felt dizzy from a heart attack. Paramedics later said that simple act likely kept him alive until they arrived. If you ever feel your vision dimming, your head spinning, or your body going weak during chest pain, take a deep breath, then cough hard every 2 to 3 seconds. Think of it as manually keeping your heart beating when it's struggling. It's not a cure, but it can keep oxygen flowing to your brain and buy you time, and that time can mean survival. Number 3, unlock your door and keep your phone close. When a heart attack strikes, every second counts, not just for you, but for those trying to save you. One of the simplest yet most important things you can do is unlock your door and keep your phone within reach. It may seem small, but locked doors waste precious minutes that could mean the difference between life and death. Paramedics can break in if needed, but every delay costs time, and during a heart attack, time is muscle. Research shows that for every 10 minutes of delay, survival chances drop by about 10%. A 73-year-old man in Arizona called 911 but collapsed before unlocking his door. Paramedics lost valuable time forcing entry. In contrast, an 80-year-old woman in Florida unlocked her door, sat by it with her phone, and survived with only minor heart damage because help reached her instantly. Always keep your phone beside you, especially if you live alone. Even walking a few steps could trigger collapse. Put your phone on speaker so you can talk hands-free with emergency responders. Think of it this way. Your phone is your lifeline, and your unlocked door is the bridge to survival. Together, they make sure help reaches you fast when every second matters. Number 2, take slow, deep breaths. It's one of the simplest yet most powerful things you can do during a heart emergency. Panic is your worst enemy. When fear takes over, your body floods with adrenaline, raising your heart rate and blood pressure, forcing your heart to work harder. Deep, controlled breathing calms your nervous system and increases oxygen to your blood and brain, both essential when circulation is limited. Studies show that slow breathing lowers heart rate and improves oxygen delivery, even in people with heart disease. A 76-year-old nurse from Michigan survived a heart attack this way. She sat upright, closed her eyes, and focused only on slow breaths, in through the nose, out through the mouth. By the time help arrived, she was weak but still conscious. If you're ever alone, place a hand on your stomach, inhale deeply through your nose, and exhale slowly through pursed lips. Aim for 6 to 8 breaths per minute. Each calm breath buys you time. Time for oxygen to reach your brain, time to reduce heart strain, and time for help to arrive. Number 1, stay as calm and still as possible. When a heart attack hits, your instinct might be to move or walk it off, but that can be deadly. Every movement forces your struggling heart to work harder when it's already starved for oxygen. By keeping still and calm, you conserve energy, reduce strain, and improve your chances of survival until help arrives. Research in the European Heart Journal found that people who minimized movement during heart attacks had fewer complications and better outcomes. One 71-year-old farmer from Nebraska survived because he resisted the urge to move and stayed where he was. Paramedics said that stillness likely saved his heart from further damage. Panic only worsens things by flooding your body with adrenaline. Instead, focus on slow, steady breathing and tell yourself, help is coming. My job is to stay still and breathe. Think of your heart as a fragile engine running low on fuel. Every movement risks burning it out. Staying calm and still buys you precious time and gives your heart its best chance to survive. Together, these 7 tips form a clear survival guide. You can't predict when a heart attack will happen, but knowing what to do can mean the difference between life and death. Here's a quick recap. Call emergency services immediately, chew aspirin if safe, loosen tight clothing, cough if feeling faint, unlock your door, and keep your phone nearby. Take slow, deep breaths and stay completely calm and still. Each step buys you precious minutes that can save your life. Remember, a heart attack doesn't always give a second chance. Acting fast, staying calm, and following these steps can help you survive and see tomorrow. Science supports it, but it only works if you're ready to act. Now I want to hear from you. Where are you watching from, and do you keep aspirin or an emergency plan at home? Drop your answer below. We read and reply to every comment because your experience could help someone else. Don't forget to like, share with loved ones, and subscribe for more life-saving advice. Stay safe, stay prepared, and remember, knowledge is power, especially after 60.